Hey guys, welcome back to Premier Chiropractic. Now in the last video, what we demonstrated was actually nerve pain / neuropathy and what it was, how you got it. And today what we're going to talk about is actually how you can get it under control. Before I start, I want to be clear. Neuropathy is not a curable disease, but what it can be reversed are the symptoms and give you the quality of life that you're looking for. We've been able to take people from walkers, wheelchairs, canes, back to dancing down the hallway out there. And if neuropathy is affecting you, I want you to pay close attention to what has to be addressed. There's actually, as I talked about last time, there's 4 things that have to be addressed. You have to address inflammation, which we have a specific protocol for that. It's actually 6 weeks that you're going to be doing this, the things for the inflammatory process at home, and then getting the right nutrients, because if that blood supply isn't getting the right nutrients for that tissue to heal, then you're not going to recover. So those are 2 vital pieces that have to be addressed. The other part of that is we talked about circulation. So one of the things, go ahead and turn that on for me, Zach. One of the things, Zach here is going to help me with some of the treatments. As you can see, he just turned his red light therapy on. So the other part of it we talked about was circulation. So if you don't have good blood supply to the feet, to those nerve coverings, you're not going to get the oxygen and you're not going to get the nutrients. So they've actually done a lot of research to actually, we are able to, with these medical grade LED lights, you can actually see these here. Some of the lights you won't be able to see. It looks like they're turned off because you won't be able to see the infrared light. So we're using, actually it says here, we're using 120 medical grade lights, 660 nanometers and 880 nanometers. And what that's going to do, what the research found, is it's actually going to create angiogenesis. And what angiogenesis is, the regrowth of blood vessels. So we're handling the nutrients, we're handling the inflammation, now we're handling the circulation and the blood supply to your feet or to your hands. Now, the 4th thing that we have to make sure that we address with nerve pain or neuropathy in your feet is actually nerve stimulation. So typically when you go to a doctor, they're going to prescribe gabapentin. Gabapentin is actually an anti-seizure drug, and what that's doing is it's actually decreasing the pain. It's good for pain, and that's why it's prescribed, to help take away your pain. But what it's doing, it's disconnecting the connection between your feet and your brain. And the last thing you want to do is not know where your feet are or be able to feel your feet, because that's where, unfortunately, where this program came from was a friend of mine that ended up from his diabetes. They actually had to amputate his toes, then they amputated his foot, and they didn't get it under control until they took from the knee down. So I want to make sure that never happens to anybody else. The condition is controllable and the symptoms are reversible, but the disease has to be managed because it's not curable. So I want to make sure you guys understand that this is not one and done. Because in addition to this program, you're going to have the knowledge and knowing what are the inflammatory foods, what are the non-inflammatory foods that you need to be putting in your body, what the nutrients are. So we're equipping you with the knowledge and the equipment to be able to treat yourself for the rest of your life. And that's powerful when you're a patient suffering from a condition, when you can be your own doctor. We don't want to be responsible for your health for the rest of your life. We want to empower you to be responsible for your life. So the other big thing that the gabapentin, we want to communicate. So what we do is actually, we had a nerve stimulator designed, and actually it was designed, it kind of works like an EKG. So those pads are going to be hooked up on both sides of your feet, and it's going to read it like an EKG, and it's going to actually start working on correcting those neural pathways so that we reconnect the nerves to your feet. So again, in summary, we got to address the nutrient deficiency, we got to address the oxygen with the blood supply, with the LED lights, specific medical grade lights is important, and then the communication from your brain to your feet. And that's what this program is about. Now, if you or one of your family members is suffering with nerve pain / neuropathy, give our office a call and let's get you evaluated and see if we can't help change a loved one's life for you. So until next time, you guys have a blessed day.